In the past few days, the UK COVID-19 inquiry looked at Module 4 vaccines and therapeutics. And this module was reported by the Right Honourable Baroness Hallett, DBE. She was the chair of the UK COVID 19 inquiry, and this was in April 2026, just a few days ago. I have a few thoughts that I would like to add to it. And the reality is that for many people, they thought it would be a dud, meaning that it wouldn't say anything significant, it wouldn't bring any new challenge. Sadly, I think they were right. I will give some thoughts because they didn't get everything wrong. There are many good things that came out of it. But in my view, there are 7 points, 7 lessons that I think are critical. And actually, the eighth I didn't think of until after I put this together. So I'll share them with you in just a moment. Before I start, if you are interested in the presentation I did recently with regards to brain fog, I have created a full dashboard for people. Just click on the link in the description. What has changed in 2020? You can see an insight into it where you can access the neurological dashboard. It shows you some of the charts. Everything will be available to you on the link, but at least take a look at this so that you have an insight into what is going on. All of this is relevant because I'm trying to do the research to predict where things are going based on the current trajectories. So that's based on hospital episode admissions. And when you look at the trajectory, you can understand where things are likely to be in the next few years. So let's start with a few of the points that I wanted to go through. The first thing that we have to do is acknowledge what they got right. Without a shadow of a doubt, they got vaccines developed very quickly. And this is an important point. They did some adjustments for age risk adjustments, but I think they discarded it as time went by and then came back to it. There was good surveillance of cases. There was at least some recognition of vaccine injury because this is how myocarditis and the VITT vaccine induced thrombocytopenic pure thrombotic VITT came into being. And they did have some communication lessons that they identified. And critically, I think they raised the compensation that was going to be given to people who were proved to be vaccine injured. Now, if you don't know, it is very difficult to prove a vaccine injury. And so for many people, they will be left out in the cold and to struggle with these symptoms. But I'll come to that anyway as one of the main points that I am taking away. And I've said it quite openly that I would be happy to stand in front of an inquiry and say, listen, these are my points. This is based around my research. It's independent. It's based on what I anticipated when I looked at autoimmunity early in the pandemic. I thought we're going to make some mistakes if there is not enough time focused on understanding the disease rather than just treating it. That's always bad science. If you don't understand, please, definitely don't just go randomly treating. That's where I started with regards to point number one. So when I looked at the strategic mistakes, the first point that I made was this. Do we need deeper pathology and autopsy analysis? Now, I've been hammering home on this for a long time. We knew there was myocarditis, and we confirmed it. But we didn't fully understand the mechanisms of it, and we didn't continue properly to look for it in histology because you need to understand what else is happening, even if it is overt or subclinical. There's damage to the lining of the blood vessels. There are microclotting, and we know macroclotting with regards to the white clots. This has not even come up as anything relevant in terms of autopsy analysis and organ pathology. What in the world is happening to organs on re-exposure to the virus after the immune system has been primed? These are fundamental, basic scientific questions. In my view, the fact that this inquiry has not raised that front and center is, in my view, one of the biggest mistakes. Now, some people may say, no, well, it's no big deal. I say that because I know disease trajectory is changing, it's not in my head. I've got the data. It's because people kept on telling me nothing was changing. Why I got the data and said, I know it's changing. What is the mechanism? How can we explain it properly without autopsy data? That was my point one. Lesson two was to do with, was prior infection fully integrated into the risk benefit decisions? Because they came up with this concept of hybrid immunity. Now, you have to understand, hybrid immunity is not something that we speak about in relation to any other infection. You don't really talk about hybrid immunity with measles or chickenpox. If you had chickenpox or measles, you have natural immunity. You don't need to be vaccinated again. But what happened is early in the pandemic, they weren't sure that the immune system was necessarily effective enough. And so therefore, they thought that maybe you need extra boosting. My point was that if you understood the immune pathology, the cytokine storm, which was certainly, you could argue about the cause of it, but the cytokine storm was an overreaction of the immune system to the virus. The question is, if people already had an overimmune reaction to the virus or the spike protein, you could argue about which one, why would you further expose their immune system again? And this is what I mean when I was talking about this risk benefit and how prior infection should have been integrated into this. Was the risk the same? What about their immune system, immune history? Was it relevant? I still think that there hasn't been enough research to look at the outcomes for those people. This really should have been a critical question for the people who had moderate to severe COVID-19 early in the pandemic. When they were subsequently vaccinated, what were their outcomes compared to other people who were probably just normally vaccinated? These are very important questions that needed, in my view, should have been looked at. The next point was to do with changing recommendations. If you remember, first you only needed 2, then you needed 3, then you needed 4, 5, 6, 7, 8, 9. That change absolutely damaged public trust. The booster messaging, it was so strange. It used to be a joke. I remember when I did a meme showing somebody with 6 needles, 6 vax points on their shoulder, saying that this is what was going to happen. That was supposed to be a joke. That turned out to be the reality. Why? Why was it that even after infection, even after boosters, people continued to need to be boosted? I think they treated COVID like flu, even though we clearly knew this is not an influenza. I don't have colleagues die from influenza. This is not a flu. And so therefore, you don't treat it the same by just updating strains. This is why we are in the mess we are, because there is such poor understanding about the science. And this is part of the problem. Number 4, I have here was about genuine public health concerns, sometimes silenced. Now, I experienced this, where when you ask these legitimate questions, this is called misinformation. And then you get labeled as an anti-vaxxer by just asking scientific questions. You don't have the open dialogue. So people who are supposed to be experts are promoted to say whatever they want, even when it's wrong. There is no challenge. What is that? That, in my view, was of the one of the outcomes in the inquiry, and they did highlight the point that there were indications, there were periods of time where things were treated as misinformation when they weren't. And very clearly, when myocarditis first started to occur, it was treated as misinformation. That is not science. If somebody is starting to tell you that we are seeing negative outcomes, you don't tell them to shut up. You say, wow, we didn't anticipate this. Let's look closer and make sure no one else is affected. Moving on. Lesson number 5. In this case, was the support for the vaccine injured sufficiently proactive? And this is still a problem today. They still don't have any clear clinical pathways. There is still issues about compensation. They are oftentimes not even recognized, and there is no clear long term follow up. And critically, in this here, the vaccine injured, a lot of them don't even know they're vaccine injured. They know they're sick. They know they're not getting better. They can't explain why so many things are going wrong. And because they have not made any connection to what had happened in the pandemic, they think that this is just random. The amount of people I have seen clinically who I can think to myself, oh boy, this is probably another vaccine injury. There's no point telling them because they may not be open to hearing that. But the point is that it's such a clear pattern and so many people are affected by it, yet there is not enough in place for them. There's not been enough research. And as I pointed out at the beginning, how can you be doing research if you're not doing histology and pathology? So if there is no autopsy studies or if it has been delayed, then it means that you talking about concern for the vaccine injured are just words and not really about finding solutions. This in my view is unacceptable. And the worst part is I think about the people who had adverse effects, especially the ones who were concerned. I think that that is probably the group that I feel most for because they had concerns, but because of mandates, which we'll come to later on, they had to do it and they are still suffering for the consequences. That is probably one of the worst feelings that people have. Point number 6 for me was to do with the evidence for childhood vaccination. Everything indicated, and they acknowledged this in the inquiry, there was a very fine risk benefit balance for children. And the evidence was evolving in the sense that the more we saw, the less concerned people were about children. But for some reason, they thought that it was important to vaccinate children. And they gave parents the impression that the risk benefit ratio was not a problem. And as I said, I think this is down to the fact that there is such a poor understanding of the science. That's the only thing I can think. Because the only reason you would think that is if you perceive this was just a viral infection, like influenza or RSV or something else. But I keep on saying that the cytokine storm was so characteristic in severe COVID-19, it should have been clear that the immune dysregulation was a huge risk. And so if you don't understand what can happen to the childhood immune system on exposure to a vaccine in the context of ongoing circulation of the virus, why would you take the risk? I genuinely could not understand why governments across the world went down that road. I think it was because they thought that it would block transmission, but we knew it didn't block transmission. So if they were at low risk, I'm talking about children who didn't have any significant health factors. So there were some children who had health issues, and in that cohort, that's different. But for the healthy average child, I couldn't understand at that point. And even the inquiry acknowledged that that risk benefit ratio was so slight that it probably really should have been studied better. That at least was one good thing that came out, but I don't think that they called it out clearly enough. The 7th point for me here, the 7 lessons, was what was the long term cost of mandates to trust in public health? And listen, this is so bad. It's not no longer just about the damage to vaccines, it's trust in all of science and medicine. Healthcare workers were mandated, and this damage to the workforce was never fully replaced, especially what happened in the UK with regards to in the social sector with carers. They had to be vaccinated. A significant proportion left the job and went to work elsewhere. And you know what they didn't realize? That being a carer is not easy. It's not a number. You have to have a passion for it. And many of those carers were doing it because of the love of the job. When they went and did something else and they realized it was so much easier and they probably get paid more, these skilled people would never come back into the caring workforce and you lose them long term. And this has done massive damage to health and social care in the UK. And I think there's no doubt about it. That was a huge bit of damage. It then went on to the healthcare workers. And again, as I said, this for me is a simple question. If you had the health force exposed to the virus, for which many died, but for over a year they survived and they served the community well, you then go and mandate them to be vaccinated? What is that? I mean, if they were at risk, they would have had that risk in the year before when they were serving frontline, taking care of patients. If they wanted to get it, that's fine. But a mandate in the healthcare sector? I mean, genuinely, if that did not come up as being something that we apologize, that was a mistake, that alone for me was a huge error in terms of not acknowledging that mistake. That was my top seven. And I'll just run through them again here so that you can see it. Number seven was mandates. Number six was childhood vaccination. Five was the support for the vaccine injured. Four was public health concerns being silenced for misinformation. Three was the changing health recommendations affecting public trust. Two was prior infection integrated. And one was the need for autopsy analysis. Those were the top things for me. I'll finish off with one last point. They spoke about in the inquiry vaccines and therapeutics. And the therapeutics they were often making reference to were therapeutics used in hospital. The truth is that we needed systems that would prevent people from getting to hospital. And there was no real effort to try and find solutions outpatient that would reduce the risk. Only a few countries like Honduras managed to implement systems. Anyone who tried was shot down for misinformation. And here is the point that I still stand on today. When the recovery trial, the Oxford recovery trial, looked at dexamethasone in June of 2020 and found that it was beneficial, where it reduced mortality by a third, why did they not go on to do a higher dose of steroids and a different formulation to understand if we could get even better outcomes? That research took 2 years before it was done. I cannot understand how they had multiple arms. They could have so easily added a high dose steroid arm in July of 2020 and clarified, because if steroids worked at a lower dose, it would work at a higher dose. In fact, you may have higher complications, but you would have better outcomes with regards to the cytokine storm, no doubt about it. And if you understand autoimmunity, we needed immune suppression. And sadly, the fact that that was not done probably implicated millions of deaths, because it would have been accepted if they had gotten even better outcomes with high dose steroids. It would have clued in the whole scientific and medical community to the fact that this is not simply a viral infection. This is an autoimmune response to some part of the virus. I believe it's spike protein and ACE2. We don't have to argue about that. But it doesn't matter what it is, you shut it down with steroids, and your death rate could have dropped almost to zero. The person who proved that was Dr. Shetty in South Africa, and they're still going after him for saving lives using higher doses of steroids. So, no doubt about it, if you timed it right and you used it properly, so many more lives would have been saved. So, it's sad that this is where we are at the present, but this is what it is. So these are my thoughts as to what had happened, what I think is relevant. It is my opinion, so we can disagree about it, but it's certainly not misinformation. And I would stand up and challenge anyone on it at this point. So I hope you found that valuable. And as a final reminder, if you want to see about the trajectory of what is happening in the pandemic, take a look at the link below, looking at the neurological dashboard. I just made a full presentation on the multiple mechanisms. If you want to learn more about that, please click on the link below and join me in this journey of science. There is still a lot more work to do, and we can only try to make a difference for the future. Thank you.